Please welcome to the stage Martin Edlund of Malaria No More, Jeffrey Graham from the U.S. Department of State, and Florizelle from the Corporate Council on Africa.
Well, hi everyone. I'm Martin Edlund, the CEO of Malaria No More. So you know where I stand on the malaria question that we're going to talk about now. But today's session highlights a powerful but often overlooked truth that stronger health systems don't just save lives, they drive economic growth, stability, and investment. And endemic diseases like malaria remain a major drag on productivity and investment on the African continent in particular, straining economies, deterring investors. Jeff and I were at a dinner with Mr. Aliko Dangote, the wealthiest man in Africa, a major employer, and he was saying, you know, malaria is a persistent and ubiquitous challenge in Nigeria and for his workforce across Africa, and it's why he's become Nigeria's malaria ambassador and set up a multi-sector and malaria council in Nigeria. But as US interests in Africa grow, so does the opportunity to change this challenge into a win-win. Healthier communities, more stable and investable markets, and stronger US-Africa trade and partnerships. So Malaria No More just launched a new report with the Corporate Council for Africa, which reveals how fighting disease can unlock investment, reduce risk, and align development goals with US economic and security interests. We should have a QR code coming up in just a second. There it is, very responsive, that allows you to download the report. So just point your phone at that and you can find the report. So we'll have a brief discussion, but a great one with two really knowledgeable panelists. So Florizelle, who's the CEO of the Corporate Council on Africa, with whom we're releasing the report, and then Jeff Graham, who's a senior bureau official and acting Global AIDS Coordinator for the Bureau of Global Health Security and Diplomacy at the US State Department. So thanks both for joining us today. So Flori, let's start with you. So we've just launched this report that shows that every dollar that the US invests in malaria control in Africa returns $5.80 in GDP growth for endemic countries, a return that actually outperforms a lot of Wall Street returns. Right. How should policymakers and investors interpret those kind of numbers when weighing priorities for US engagement in Africa, including the compacts that are being negotiated now with the release of the new global health strategy last week by the State Department? Flori.
So first of all, thank you so much for having Corporate Council on Africa be a partner in launching the new report that shows the economic impact of malaria on countries and on companies, on the private sector. It shows that 72% of companies in the report indicate that malaria has an operational impact on them, either in terms of employees not being able to come to work because they have malaria, or having to stay home to take care of a family member that has malaria. And so it's important that we know that the report notes that it is a $12 billion tax annually on economies in Africa. And in the larger context, we have to also think about the fact that African countries are now doing a lot of the hard work to remove barriers to trade and investment, to create the kind of enabling environment that will facilitate investment into their countries using things like the African Continental Free Trade Area, AFCFTA. And one of the factors we know that companies are looking at as they look at the investment landscape in Africa is health security. They're taking lessons from what happened during COVID and post-COVID, and they're saying, okay, a country that is investing in its health systems is a country that's going to actually provide a better environment for us as a corporate in those countries. And so one of the things that we hope that policymakers like Jeff and also on the continent will look at malaria and reducing malaria as an investment in their economy. It is just as important, for example, as investing in roads and ports, because it is going to create an environment where people can be healthier, they can show up for work more often, they can be more productive, companies basically can be more profitable, and more investment will be drawn to those countries. So we hope that policymakers will see malaria not just as a health issue, but as an economic empowerment and enabling issue as well.
I love the idea of thinking of malaria investment like roads and ports as enabling business. And you mentioned the 72% of companies that say that malaria impacts their businesses. 39% of companies in the report said it's a severe impact, one of the top impacts on productivity.
And just one other point, 80% of the companies are small and medium-sized companies, SMEs. And so you can imagine the impact that it has on them. So, larger corporations, of course, feel that impact. But imagine what that is for 80% of the companies who are SMEs, who are operating. Maybe they only have, 5 workers or 7 workers. If you have even 1 out of 5 that doesn't show up, think about what that does.
Yeah, absolutely. Thanks, Flory. So, Jeff, last week, the State Department launched its America First Global Health Strategy. Congratulations on that. How does the State Department think about the intersection of business and malaria? How are you, on the one hand, looking to enable investment and growth for American companies? And how are you harnessing American capabilities to enable positive health impacts?
Thank you. Well, thanks for having me here. So I'll start by saying I served in Ghana some years ago, I won't say how long, where I had the great honor to meet Flory for the first time, who taught me the phrase trade, not aid, and taught me a lot about trade negotiations. And we would see at the embassy all the time some of our local staff, they would come in just sweating and really moving slowly. And I remember asking one day, "Are you okay?" And he said, "Oh, I'm fine. I just have a little malaria." And I thought, how do you have a little malaria? And why are you here? So the drag on the economy, absolutely a great point. Also, we talked a lot, last night about deaths in children under 5, huge impact across Africa. For us, the strategy really gets at a couple of things, and I just want to come around to your question. So one is this long overdue move towards self-reliance. We have gotten actually a really warm welcome, in particular from African governments who have said this is long overdue, and we like the idea of having more control over our own destiny and our own health systems, and so how do we negotiate agreements with them? But where we're thinking about the private sector in all this is an opportunity to do things a little bit differently than we've done in the past. And we call out, very specifically in the strategy, the role of the private sector, whether that's American innovation in particular of great interest to us, or it's local private sector in Africa. It also lines up with what you've heard Secretary Rubio talk about, which is commercial diplomacy. So using the power of our diplomatic platform overseas, together with our partners from the Department of Commerce, of course, and others, how do we do more in that space? So we're not just doing health response that may go on forever, but really trying to figure out how do we provide market opportunities, but in a way that helps us eventually shift the burden so that these countries, have a more sustainable approach to their own health responses. And I think there are lots of opportunities in that space. I think some of the ones we highlighted are manufacturing on the continent, logistics and delivery systems, private labs and pharmacies, rather than having everything run either by private clinics or government clinics. Data systems is a huge opportunity. So we've started a number of conversations with private sector friends that have continued this week. Our launch event was actually Monday at the U.S. Chamber with our private sector friends talking about this very thing. And across the other, I'll say one more thing, exciting thing here is we're actually integrating our disease approach for the first time. So we're getting rid of the silo. So we're going to do HIV, TB, malaria, and other diseases together. So we'll do a strategic planning on the front end that is unified, and then delivery on the other end, because this is also what we hear from our partners.
One of the guests at the dinner last night, it was quite a dinner, was Fisk Johnson, of the CEO of SC Johnson. And they have a new spatial repellent, which the WHO just endorsed. And Fisk had one with him at the dinner that he was kind of passing around for people to see. You know, the malaria pipeline is bursting with transformative new technologies, many of them from American companies. So it's a great moment to think about the thrust you just described. One of the other things in the strategy was a focus on surveillance systems and particularly kind of early warning and response systems for outbreaks of novel pathogens. You know, malaria, U.S. investment in malaria in partnership with countries has built what I call the world's best fever finding and fighting network. We're testing about 273 million fevers in rural communities across Africa every year. How can we build on that platform to accomplish some of the goals in the strategy?
Well, that's a great question. And again, I'll tell you another funny story of going in with a fever one time to the health clinic in Accra at the embassy and being told, you don't have malaria, but you have one of the other 100 or so diseases that look like malaria but won't kill you, so don't worry about it. And that was a surprise to me, but I guess the it's not going to kill you part was the important part. But this detection, malaria fever detection is such a key part of this because malaria, so many other diseases mask as malaria, and so, you know, and it is the first, we have to react so quickly to it. I think in terms of the outbreaks, what we also very intentionally talk about in the strategy is making good on something we've also been talking about for a long time. When, you know, of course, the Bureau at the State Department is built around the PEPFAR platform, and everyone knows PEPFAR. Now, with the integration of USAID health programs on July 1st, for TB, malaria, and others, we had the opportunity to integrate, as I said. But the vision is what the Bureau was created to do 2 years ago, and now we're accelerating this process, which was to take these long-term investments, not just in Africa, but particularly in Africa, where we have helped countries build very robust health systems for our own, for the PEPFAR system, for the President's Malaria Initiative, and start integrating them back into their national systems and leaving behind a monitoring platform. No surprise, it's called the America First Global Health Strategy, which means protecting ourselves. But the way that, if you look at the strategy, and I hope you've all had a chance to see it, there's enormous good we can do at the same time. So it's not just for ourselves, it's how do we build this surveillance platform and in a way that's going to help those host countries while also protecting American shores. So malaria is going to play a key part in that. I think also polyvalent testing, having health workers who can go out, so what we don't want to keep doing is having the HIV health workers, the malaria health workers, the tuberculosis health workers. Many of these tasks can be done by the same people, and so there's great efficiency to be had, but also this, looking for a better term, but a disease agnostic surveillance platform that we can leave behind.
And we were encouraged as Malaria No More to see continued commitment to some of the high-level goals on malaria, more than a 90% reduction in malaria cases and deaths, the goal of 35 countries eliminating malaria by 2030, and continued commitment to the life-saving commodities, the tools that we've talked about in the frontline workforce to deliver them. So lots to build on there. Flori, one of the stats in the report is that more robust malaria control systems, prevention systems, can attract 16% more foreign direct investment into endemic regions. We've just heard from Jeff that that's what the government is looking to enable. How do we get the message out? How do we convince companies that Africa's ready for investment as we bring these health challenges under control?
Right, so that figure of 16%, those countries that have robust malaria control in place, programs in place, are attracting 16% more FDI into their countries than other countries across the continent that are not focused on controlling malaria. So it really just goes to show you how important it is. And as African countries are scrambling to develop these regional supply chains, it's important for them to be able to now say, okay, investment into malaria control and having secure health systems is another way to be more competitive in the global economy. It's also important to think about how trade ministers and finance ministers should be looking at controlling malaria as a part of their overall health program and strategies. Sometimes, unfortunately, it's focused on building hospitals. And it could be also on rural clinics. All of that is great, but the returns on investment, as we said earlier, for making sure that malaria is under control, especially because it has long-term implications. You know, those children, those young adults, those workers who contract malaria, it's not just the short-term impact, there's a longer-term impact as well. And so we want to really encourage sort of a new way of thinking about malaria control and the way that it needs to be invested in. The returns are high because you think about the fact that productivity is increased. You think about the workforce in Africa. It's already large and will be one of the largest suppliers of labor to the global economy. So we have to have a healthy African workforce in order to have African economies that are growing and strong, but also to have a global economy. You know, they're going to be the consumers, major consumers of products, you know, not just in the health sector, but, you know, electronics and so forth. So that thinking, that new way and approach of looking at malaria control and how it contributes to productivity is something, and both in the short term and the long term.
As you point out, Flor, it's not like Africa is an island and isolated. You know, by 2050, 1 in 4 people on the planet are going to be African. 60% of youth on the planet are going to be African by 2050. So, you know, as we talk to American companies and investors, they're really thinking about Africa as a growth market. Jeff, you guys announced in the strategy last week a new model, a compact model, where you're actually negotiating kind of time-bound commitments on both sides with African counterparts. How do you bring trade and health together in those conversations? And I know they're just getting started, so you may not know yet, but.
Yes, very, very early days. I think probably the most important point is something Flori just said, which is conversations just with the ministers of health will only go so far. You need the Minister of Finance in particular at the table. And you may need, you know, we all know in Africa there's the person, it's the cousin of the president. You know, who's that person who, if you don't have that person, nothing gets done. So finding who are the right people in the room for the conversation. Figuring out the milestones, I think, is particularly challenging. I hope people are also tracking the Accra reset being led by President Mahama and former President Obasanjo of Nigeria and others, which had a meeting yesterday, really trying to push an African-led reset of how aid works and how development works, with these same concepts of, you know, rather than talking about where are we going to go find more donor aid, I think those days they haven't ended, but they've changed. And talking about we need to really go back and actually look at our national budgets. I think nobody thinks that GDP growth, you know, in the next few years is going to magically take off. So there's some hard decisions that governments will have to make in terms of how they manage their own shifts in the budget. But as you say, the demographics are undeniable where we're headed. And I think anyone who's smart should be thinking about this. And it sounds like a long way off, but that's less than 25 years. So start thinking about it now. And I think for our, you know, as we've done we know when we were in government together for years, having conversations with governments about a lot of this responsibility is yours. We can push, and we can push pretty hard as the United States, but it's ultimately up to partner governments to make the enabling environment open and welcoming for investment. They always say, we want to have investment. Okay, so do the hard work and open your market. And I think, I love what Flori said about, you know, investing in malaria as an economic tool rather than just a health tool is a fantastic suggestion.
Absolutely.
So I see we're just about at time. I'm going to ask if we can put the QR code up again. If you weren't motivated to download the report when we first put it up, hopefully you can pull out your phones and find the report now. I want to encourage you all to read it. I think it's highly relevant to the conversations that are happening in real time between the US government with its new America First Global Health Strategy and these compacts that are being negotiated. So it's very timely as we meet this week. Let me end by just saying thank you very much. Flori, great to hear your perspective working with American companies who are investing in Africa. And Jeff, thanks for your unrolling the and explaining the global health strategy. Thanks for your hard work and leadership.
Great.
Thanks.
Thank you.
Thank you.